this presentation is for educational purpose because like I'm not sure if like all of you are my patient or not. Like if you are not my patient, like this presentation is not like does not create a doctor-patient relationship or replace any professional medical advice. Always consult your healthcare provider. Okay, like so this one is for educational purpose only. For cancer screening, like there is always like there is advancement and also always like people find people try to find new ways to detect cancer earlier and earlier to be able to save more lives, right? Like kind of like pretty recent, like there is a multi-cancer screening through a blood test that can detect like more than the typical cancer that is screened at this time, like with our standard care. Why we are here? So like a lot of us like has been deeply touched by cancer, like some friends, some family members. We all of us like must know like someone that has been affected by cancer. And the later the detection, like often means like few options, like we cannot do much because like it's in the late stage. That's why like we want to detect cancer as early as possible so we can take care of it like with the least invasive way. Even for me myself, like I also lost like some like a very close like a relative to late stage cancer. Like one of them actually at the time of diagnosis is actually already at stage 4. So that's why like I would like to share this breakthrough with you. With cancer, like with age, actually, like the cancer risk increases. Like by the age of 50 and over, like the cancer risk is like 13 times higher. But I hope like this doesn't really make us like live in fear that oh like I'm getting my chance is getting cancer is higher and higher. So like we live in fear. I hope like this is not what we have like by hearing this, but we can be more proactive and we can live a better lifestyle so we can prevent it better and like we can do whatever in our power to minimize the risk of cancer and also to detect it early and to help people around us as well. So yeah, the incidence of cancer is about like a 1.2% of incidence per year in population of age like over 50. Um, Age is the strongest risk factor for cancer. Like for on average, like the rate is like 13 times higher than under 50. Other risk factor consists of like previous smoking, previous history of cancer, family history of cancer, especially those that is more like hereditary. Higher body mass index, like if you haven't seen, like I also have like I make like 2 videos that's related to cancer. One is about like cancer, early cancer sign, and the other one is like how we can minimize our risk for cancer. Later on, maybe Steph can share like the videos that I make as well. Infections like hepatitis B, HPV, HIV that could increase risk for cancer, and also like the environmental exposure, like asbestos, like Agent Orange. That's the one that used in Vietnam War that could also increase the risk for cancer. Um, for now, like cancer 71% of cancer do not have any recommended screening. Current tests, like usually like as you might have known, like when you come for physical, um, for female, like it will screen by like a breast cancer, and then like colorectal cancer for 45 and over, breast cancer usually starting from 40, lung cancer for people that has like previous history of smoking, and cervical cancer. Cervical cancer used to be like the number one cause of death for female, but because of early screening, now it's like very, very low. So like early screening actually does save life. But for like 71% of like the other type of cancer, like there is no standard recommended screening. Let's like pancreatic cancer, it's hard to do like early detection. Um, so this test, the one that I'm going to present, is actually like just one simple blood test, like just one simple blood draw. It detects signal that's shared by over 50 types of cancer. This one is designed to complement, not to replace the routine screening. So you will still want to do your routine screening. Doesn't mean like, oh, after I do this test, like I don't have to do like the routine screening anymore. Okay. The epidemiology and also like the public health, they try to choose like what is the most cost effective and what are the age range that's the most um uh yeah, the most cost effective and also like better like screening time. So it's not causing a lot of fear or a lot of additional tests that's unnecessary, but still can catch more cancer. Um, but epidemiology is epidemiology because they have to think about like public budget and everything. So it cannot cover each and everything. Okay. How does this test work? Like so with the blood draw, like it's analyzed the cell-free DNA that's circulating in the blood. Um, the cancer cell usually like will kind of like shed its cells, like the cell-free DNA, into the bloodstream, and then like so this one catch that and analyze with the methylation pattern. Methylation pattern can show like what type of cell was the origin, and whether like this is like the type of like cancerous cell or healthy cell. So it also predict like the likelihood of like the tissue of origin. Um, to give you like some example, let's say this is like to give you like some illustration with our daily life. Let's say like bread, right? Like maybe I'll talk about it like later when we talk about genetic testing. Okay. Um, what is this test not? This test is not intended for people with symptom. If you have symptom, then like what you need to do is really to do the test that related to the symptom. Let's say for someone that has like blood in stool, they need to do colonoscopy. For people that has like a vaginal bleeding, they need to have um, like colposcopy, like or endometrial biopsy. People who has like hemoptysis, like they need to do CT scan of the chest, like so. This is not for people with symptom, okay? And this is not a genetic test either. Like this one is not assessing the inherited risk, but this one is detecting actually like some of the cancer cell components that is released to the blood. And this one is not really a diagnostic test, not a definite diagnostic test. So if you see a positive test in this test, like you will need to have additional follow-up. It's not saying like, oh, you have positive test, and then like most likely the cell is from ovary or from pancreas. It means like you have ovarian cancer or you have pancreatic cancer. You need to do like further testing to confirm. Okay. Um, who like this test might benefit? Like for adult over 50, in general, like this one could benefit those, and also like individuals with like personal or family history of cancer, like people who has like high family history of cancer, or like some people like they don't really have like that much family history of cancer, but they just want to be more proactive. So they want to do like proactive care and see whether there is any sign of early cancer. Um, so the sensitivity across so I will show you like okay, here it is. Okay, the sensitivity like is different like from one type of cancer to the other. The more aggressive the cancer is, like the higher stage, or like the more aggressive, the more it shed cells to the bloodstream. the more sensitive this test will be. So like the early it will detect. So let's say like the liver or bile duct cancer, head and neck, esophagus, pancreas, ovary, those are like the higher, like it's more sensitive. But the cancer that doesn't shed that much cells to the blood, let's say like thyroid. Thyroid most of the time is encapsulated until its late stage. Or let's say like skin cancer. Skin cancer like basal cell or squamous cell, that doesn't really shed much. So like that doesn't, unless if it's melanoma, melanoma that's like, melanoma is the most malignant compared to other type. You see here melanoma. Melanoma is one type of skin cancer that is more malignant, that's spread easier to the bloodstream. So like this could be detected like a more sensitive for melanoma, but not really for the basal cell, squamous cell, thyroid also less, prostate also like mostly in the beginning stage is more like encapsulated, so it's not that sensitive for that. Okay. Um, like here it says like the more aggressive, the cancer tends to release more cell-free DNA to the bloodstream at early stage, so making them more likely to be detected by the Galleri tests. Um, yeah, this is the sensitivity similar to the one that we talked before. And then like two of the 12 cancers that account for the two-thirds of US cancer death is actually like the sensitivity is quite well with this test. Okay. If you see here, like the later the stage, like the more sensitive like this test will be. So the benefit of this test is it could detect like earlier compared to like what the options that exist at this time. So it could also improve outcome and more peace of mind, but like it still doesn't detect like all type of cancer. Let's say like I don't see it detect, let's say like brain cancer, like not, I don't really see that in the list of the tests that's listed, and the follow-up is still required if the signal is found. Okay. So what to expect like with this test, like it has to be ordered through a physician, like it's a simple blood draw, and then like after the analysis, like we can see whether, oh okay, like after the analysis like there is no signal of cancer or predicted of tissue of origin, or like there is a suspicion of cancer that you will need to do a subsequent test. Okay, then like we will need to go further to find out whether or not like it's a confirmed cancer. Um, so okay, like now we are going to talk about the difference between genetic testing and the cell-free DNA testing. The genetic testing doesn't mean that like even though if you are positive for the genetic, it doesn't mean that you have the cancer. It just means that you inherit the gene. Um, to give you like illustration is like this, like so I cannot think of something in our life, like let's say like to have bread, right? Like having the genetic means like you have the flour, but it doesn't mean that you have like the possible component material that like could kind of like it's not 100% like this, okay? But just to give you some illustration to make you um, uh, easier to imagine. So you have the flour, but having the flour doesn't mean that you have bread, right? But like if you have like this test means like you have like cheese bread, you have potato bread, you have sourdough bread, and you have so many types of bread, like multi-grain bread, and like those bread are already there. Like it's produced by different factories, or like it's in different locations, and like it's kind of like release the crumb. It release the crumb that goes to the bloodstream, and then the bloodstream, like the blood draw will draw the blood And then like it analyzed like oh, is there any crumb from any type of like bread, like what we say, like this type of cancer, like different type of cancer, is there any crumb from anything? And then like so it analyzed and then like match to like oh so it doesn't have any crumb from this type of cells, it doesn't have a crumb of so like it analyzed those and then like it will determine whether there is any or like there is none found. Uh, the methylation pattern also like could detect like so of course like the bloodstream like will have like a shedding of the cells from many different organs as well, but like the methylation test could also like detect whether the cell looks like cancerous or like the cell looks healthy. So that's the difference between the genetic testing and the cell-free um, DNA testing. Somebody who has the gene for a certain type of cancer doesn't always manifest as cancer in their lifetime. Okay. Um, so the final thoughts, like the cancer often grows silently, and then like early awareness can change outcome. Okay. Okay, so like, is there any questions? So like, I'm going to open up to question.